Let's give a nice warm welcome to our alumni, Dr. Udell.
Well, it's good to see y'all. It's not quite the same as being in person, for sure. But
We've got about 15 people here.
well, that's great. So I can see some of you. I can see a lot of the names, even if I can't see the faces. So, well, thanks for having me. And
Well, thanks for doing this.
Oh, you're welcome. Yeah, sorry that Dr. Haller can't join us. We just have like a lot going on right now. So she's off helping to keep the practice moving forward. But so unfortunately, you're missing my better half. But you're stuck with me. But
Okay.
I will do my best anyway. So, all right. Well, thank you for the introduction, Joanna. The topic that was talked about today was about building a patient base, which is, I think, an interesting topic, especially given what's going on right now. But here's the basics. What I really want to do is actually allow you guys to ask more questions than just listen to me speak, because that way we can get to what you really want to know, and not just what I think you should know. But I would say, when I thought about this, that there were a few main things that came up for me. What I was trying to think about is, what did I not learn, either in school or in the immediate, aftermath after I got out of school, that I have since learned that I think is essential to building a patient base. And I think there's three main things that, that I thought about, and Dr. Helen and I talked about this, so it's not just my opinion, but, one of them is this. We certainly learned in school that we have to educate our patients, right? That's an essential feature of being a naturopathic physician, right, is educating our patients. But what I didn't really comprehend at the time is that educating our prospective patients or the public is an essential tool in developing a patient base. In other words, we talked a lot about once you already had patients, you have to do education with them to help them understand what you're doing and what you expect of them and how to get the most out of what you're doing. But not really, I didn't understand that the way you get new patients is by educating the general public or some segment of the public as to what it is that you do and what it is that you can offer them, right? In other words, that's a key element in connecting with prospective patients, and so that would be one thing. Two, I think the other thing that it took us a long time to figure out is that what was I'm skipping to number 3. What was my number 2 before I don't want to blow number 3 by skipping over number 2. So patient education. And I'll get back to detail. So the other one is that whether you like it or not, you are engaged in sales and marketing, right? In other words, most of us did not go to school to become naturopathic physicians because we're interested in sales and marketing, right? There may be some of us who have that background or who have that interest, but most of us are really passionate about the medicine and treating patients. And most of us don't think of ourselves in that sales and marketing role. We think that's what people do who go into business or the corporate world or that sort of thing. But I think the thing that we really have learned, and it took us a long time to come around to, is that these are essential tools that need to be part of, in some sense, your naturopathic toolkit. Because if you are not willing to engage in sales and marketing, you can't build a successful practice, right? And so if you have a problem with that, then you have to ask yourself one of two things, right? One of those things that you have to ask yourself is, do I really believe in what I'm doing as a naturopathic doctor? Because the one thing that really makes me much more comfortable with that proposition of sales and marketing is that I 100% believe in what we do. So when I'm doing sales and marketing, right, I am not actually trying to convince someone to buy something that they don't need or that I don't believe in. But I'm actually educating them about the benefits that they can gain through what we do and what we can offer. So really what helped me with that was coming to the real overt and concrete understanding that if I believed 100% in what I did, then there should be no hesitation to market it and sell it to people, essentially. And I think the other part of that is that you have to market. I think this idea that you just like hang out your shingle and people will come is not true in most cases. It may be true in certain situations, like maybe you're in a small town where there aren't a ton of people know each other, and there aren't many people doing what you do, where, you know, really just hanging a shingle and everyone in town knowing you may be sufficient marketing for people to know that you're there. But in most places, since most of us these days are practicing in cities and often large cities, that's not the case. There's a lot of people vying for your prospective patient's attention, and you have to get yourself in front of them through a very conscious, you know, kind of strategic effort to do it. There's lots of different ways to market, for certain. And I think most of us who are successful find that we have to do multiple lines of marketing simultaneously. Not just, you can't put all your eggs in one basket, but you definitely have to have an actual thought through, planned out strategic marketing plan in order to be successful. And then the next part of that is what I was saying before, is even if you market successfully, meaning that you get people's attention, they're not actually paying attention to what you have to say. In order for them to become a patient, in most cases, you do have to make a sale, which I think, you know, at least that used to hit me earlier in my career as like something distasteful. Like, oh my God, like I'm not a salesperson. I don't want to sell anything. But in some sense, we're all always selling something, even if we're just in a conversation and we're, you know, in a discussion with someone and we have differences of opinion and you're just selling your particular point of view, meaning it's a sale in that sense. You have to actually then actually make a proposition to them to become your patient, because just because they're paying attention to you, right, in some way, shape, or form, meaning they're reading your advertisement, they're reading the blog on your website, they're looking at your social media posts, whatever you're doing out there, doesn't actually mean they're going to take the next step to actually come in and be a patient. It's the first step. It means they're paying attention to you, but at some point you have to actually, you know, make them an offer or a proposition that says, well, instead of just like watching me on social media or reading my blog or visiting my website, you know, how about you actually come and take advantage of what we offer and become a patient? And there's lots of ways to do that, but you actually have to have a method or a system in place to do it. So, you know, that more than anything, I think has been really important for us. And in our case, since we run a cash-based practice and are not attempting to do an insurance-based practice, you know, the other thing that you have to do is you have to have in your education of prospective patients. So, right, you got to, let me put it in order. You have to market first, meaning, and I'll just call marketing in a general sense, you have to get yourself in front of people some way, somehow, whether that's physically in front of people or that's virtually in front of people or that's with something in print. But you have to get yourself in front of people and get some of those people to pay attention to what you're saying. And then the next step, I would say, is the education. Now you have to educate them about what you do and why it may benefit them, you know, how it may solve a problem that they have. And especially if you're going to operate in a cash-based practice, where right now I would still argue that the majority of naturopathic doctors are in cash-based practices, you actually have to then dispel the myths surrounding the insurance model and why you're not in it and why they should actually spend their hard-earned cash to come see you when they could just go see a medical doctor and pay a copay and use their insurance. So you have to do actually very specific education, and it's beyond just, hey, this is what I do as a naturopathic doctor. You actually have to speak to them in a way that they're going to identify with, which is acknowledging that they have some sort of a problem that they're looking for a solution to, and that you have that solution to their problem, right? And that even though you're outside of the insurance model, that your solution is still a superior solution and it merits them spending money out of pocket even if they have insurance. Does that make sense? You have to work them through that whole sort of line of thought, because whenever you're marketing and selling to someone, there's always going to be what you might think of as obstacles to that sale, if that makes sense. Meaning, like, all potential customers have objections to what you're doing. And those could be all types of objections depending on the industry that you're working in. But what you have to do is you have to actually have a sense of what those objections may be and actually have an answer for each of those objections. Like, for example, why would I come to see you when I could just pay a $30 copay and go see an insurance-based doc? Why would I, not do that? This is what I mean by overcoming their objections. And then in the end, you actually have to sort of ask them to take action, right? Because in the action of just listening to you or reading your stuff or watching you on social media is a start, but it won't actually bring money into your practice. It won't pay the bills. You could become a social media star, but if you can't monetize that, you can't pay the bills. And so you have to have a way that converts that into revenue into your practice. And when it's all said and done, like it or not, unless you are going to go get an academic position, where you get a salary, or perhaps go work in the supplement industry, consulting, that kind of thing, and get a salary, or perhaps work in someone else's practice where they're going to pay you a salary just simply to see patients. In any other case, you actually are running a business. And so in addition to all your doctor skills, you have to develop the business skills, right? And if you're going to run your own practice, you're an entrepreneur. So you really have to develop the whole suite of skills that goes along with entrepreneurship, which is everything from, the administrative side of running a business to the marketing sales side of running a business. And you have to be able to put those together in order to run a successful business. But like I said, for both Dr. Howler and myself, the thing that makes that much easier than we originally thought it would be is that we 100% believe in what we do. And we 100% know that we're helping the vast majority of people who come to see us, and that in the end, the return on their investment is huge. So think about that. No matter what your fees look like, right? If people actually start to get their health back, what's that worth, right? In some sense, when someone has a chronic disease that isn't getting better or doesn't have a cure, and they start to experience improvements in their health, how much is that worth? I would argue that you could not charge them any amount of money that actually equals the value of that for people. So if that's what you believe in, that's what you're doing, and you feel solid in your clinical skills, you have nothing to fear from learning to run a business and marketing what you do and, asking people to come be your patient, so to speak. So that's what I would say. I mean, I think that's the main things that we've learned. All the specifics, those are the details, the logistics. You do have to learn those things, but there's a million ways to do that. There's any number of, strategies for getting people's attention. And there's any number of different styles for helping move those people from being interested to actually becoming your patients. And so those are like what I might think of as the techniques that we learn along the way. And the more of those we know, the more diverse our approach to that can be, which, I said at the beginning that this, what's going on right now with this pandemic is a good time to talk about this in some sense, because I think now more than ever, what we've learned from it is you can't have too many of your eggs in one basket, because, life can change suddenly and swiftly. And then all of a sudden you're in a whole different position, which is actually something that we're, dealing with right now. And part of why Dr. Howard's not with us, because we're having to pivot within the way this pandemic has changed the way we generally reach out to our patients. I mean, the good news is for us, we haven't lost patients as a result of the pandemic. So the good news and the bad news is, we're just as busy as ever in that sense, but we're actually busier than we were before, because our main source of bringing in new patients was through live events. So Dr. Haller has, regular events held in public places, mostly restaurants, where, we bring people in, we, invite people into these talks or these seminars. And she basically provides them some education, and then at the end, an opportunity to become a patient if they're so moved after, the educational seminar that she just gave them. And it was a very effective approach for us. Well, guess what? Can't do it anymore. All of a sudden, can't actually go out into restaurants and do live events. Can't go anywhere and do live events. And even though we always did a little bit of digital marketing and dabbled in digital marketing, it was always like a sideshow to the live events, because the live events worked so well for us. And I think because we like them, because we're people, and you get to really connect with people in that sort of way. But now we're having to take our digital marketing from dabbling and it being a little bit of a side flow to it has to become the main flow. So all of a sudden we have a whole new learning curve, despite how long we've been doing it. And that's what we're working on right now. So with that said, who's got questions?
Dr. Udell, hi.
Yes.
My name is Desi. So nice to meet you.
Hi, Desi.
Hi, can you hear my microphone okay? Sometimes it's not clear.
I can.
I was just about to ask you what sort of, because I wanted to start my lead generation for clients. I have a couple of years left. I want to start my lead generation for clients, and I'm finding some good online tools to do that. And I wanted to find out more, just before you said that you didn't really use online as much, but I still wanted to find out what online tools you might be using to find your clients. And when you have time, if you can go into a little bit of detail about how you run your live events and how you use that to foster relationships with some of your clients. That would be great. Thank you.
And the last part of that was how we use our online stuff to nurture relationships.
Live events. Your live events.
Live events. Okay. So, yeah, so I mean, before this thing hit, I mean, where we still had some presence was, we have a Facebook page, we have an Instagram. We've dabbled in Twitter, but haven't really used a ton of it. But Facebook and Instagram have been our main two social media outlets. We have a website, that has, it's not overrun with information, but has quite a bit of information, and it definitely has action sort of oriented sort of things for people who visit the website, meaning like the website not only has our phone number, but they can essentially click on a button and they can register formally for a live event, or they could register for a webinar version of that live event. So they could actually take action to connect with us directly from the website. So those were all things that we did, online before. And we did get some, we did get some patient flow and lead generation just from people organically visiting our website, and, essentially registering for either a live event or a webinar. And we also, also were able to generate some leads through Facebook ads, as well.
How many of those people that you visit, I mean, was it a lot, like 10% of your patients came through your website, and or through social media? And if so, how many people who contacted you through those mediums actually converted into paying patients, long-term
All
patients?
right. Those are great questions. You have very good questions because of the right kinds of questions. I wish, well, if Dr. Haller was here, she could, off the top of her head, give you more of the actual real data, because that's her side of the practice, basically. But what I can tell you is that, organic visits to our website, they're a small percentage of the leads we generate. They're probably like, I would guess they're in the 5 to 10%, maybe 10% area, though their conversion rate is higher when they visit us that way. So we have a better conversion on them, but they make up a small percentage of the practice. Live events by far before now were the vast majority of the lead flow generation, and that was largely through print marketing. So that was actually through sending direct mailers out to people's homes. So postcards that actually went to their house. And we've experimented with other things like coupon books and stuff like that that go out to people's houses, and have had some success with that too. But we had the most success with just a direct mailer that has essentially invited people to our live events. And then the other way that we'd get people to live events were Facebook ads. And so at one point I would have said that Facebook ads, when we were doing them heavy, they accounted for the highest percentage of lead generation, right? But the direct mailers accounted for the highest percentage of actually what we call butts in seats, meaning like actual people showing up to the live events. So with Facebook, what we found is you have to generate a much larger number of leads to actually get people talking to you, because they're much flakier sort of leads. It's easy for someone to click something on Facebook, but they have much less reason to follow through than someone who receives something in the mail and actually physically calls your office and speaks to someone there and then registers for the event. So the show rate on the people who come to us through the direct mailers is much, much higher than the show rate for people who come to us through Facebook, where the show rate's actually really low. But you can make up for that by generating a lot more leads on Facebook and being a little bit more like aggressive in the lead flow once they become a lead. So the other thing to keep in mind is someone becomes a lead, but if you don't nurture that lead, then the likelihood that they actually become a patient is really low, because it's just one point of contact. So once someone becomes a lead, you have to have a system in place to what we call warm or nurture the lead, which means that you have to actually now continue some form of contact with them so that you're developing a relationship, so to speak, even if it's a virtual relationship at this point. And that is how you bring someone to, whether it's a live event or to a phone call, like a free consult or something like that. And so we learned that we had to put more attention to that with the Facebook leads than we did with the direct mail leads. And I think it's just because there's more of a barrier, right, on the direct mail, meaning you have to be more interested in it to take that mailer, read it, make a phone call, and then decide to register for the event than you do to click I'm interested essentially on Facebook. So both ways can work, but what number of leads you're going for and how many of them you expect to convert is just going to be different through those different media essentially. The thing that we like just started experimenting with, which we hadn't done much of before, is direct email marketing, and using that essentially to funnel people to whatever you're funneling them to. So the most recent thing we did was funneling people to a free webinar that I did on immune health, which was relevant to what's going on right now. And that actually played well. We got a decent number of people to that free webinar, at least to the live event. And then we got a lot, probably, I don't know, 30 or 40% more people that watched the replay of that webinar. But, live, I think I had 113 people register. And it was a really quick turnaround from the first time we announced it to when it happened was like a week. And, I had 113 people register. I had, 85 of those people actually show up at the live event. And it was an hour and 20-minute webinar. And I think I had, I had easily 76 people with me until probably 95% of the way through the webinar. So getting that higher percentage of people to pay attention to you for an hour and 20 minutes, that was good. And then from there, then the question is, what do you do, right? Like that could just be where maybe all you've done at that point is you're content that you got their attention. They know who you are. You collected their email addresses. And now they can be reached out to again for some other offering down the road. Or that free webinar could actually have an offer at the end of it, which is what we did in that case. Is then I offered a class, so I gave them a lot of valuable information, things they could go do right away. But then I offered them a class where I actually will guide them through implementing these lifestyle practices to improve their immune health. And that's a paid class. And so there's lots of different ways to work it. And there's a lot of different people out there that are kind of gurus and experts in all these different forms of digital and non-digital marketing. And there's overlap. You could use print marketing to advertise an online event. It doesn't have to be digital. But as far as it, trying to answer your question, yeah, that's where the percentages kind of fit for us. And at this point, we realized that we had reached the end of our expertise in-house in terms of how to go from what we were doing, which was all in-house with some vendors helping us with things like the direct mailers, to now we need all of the patient flow right now to come digitally. And so, that first thing I just told you, that we did on our own and we had some success with it, but we need numbers to be bigger to keep the practice rolling. And so we just brought in a digital marketing company to actually help us with that, who actually, are experts in utilizing these various tools. So I hope that answers that part of the question. But then you had a question about the live events. Just restate that.
So many questions now because I'm like actually trying to set all this up for myself and like maybe make it like digital, like a digital marketing thing because people keep asking me for help. But I don't know. Does anyone else have any questions? I don't want to be like the only one asking questions.
Well, I'll finish with Desi before anyone asks another question, just by saying I 100% encourage you starting to do that right now. I think you getting a head start on this is great. And right now, you may not actually be selling them anything, so to speak, per se, but you're creating recognition, right? That you're creating a presence and people who know you. And that could be as simple as regularly sharing with them information that's educational and helpful to them. Now, that's still okay, that's legal for you to do even as a student. Obviously, none of us probably want to give specific healthcare advice in that kind of like online format. But certainly there are certain things that you could say once you're licensed that you still may be hesitant to say as a student. But there's lots of just general health related information that you can put out there now that helps you get a following. And then those followers are going to be a great starting source for you when you actually open your practice. And now you translate that into more formal marketing to them. And anything you could do now that allows you not just to get them to like you on some sort of social media or follow you on social media, but actually gets them to give you their information, the email being the most golden bit of information, is great. Like if you were going to publish a newsletter or a blog or something, but that, you know, they have to give you their email so you can get them that information. Now you're really starting to develop way in advance of opening your practice, essentially a lead flow that
Exactly. Yeah.
convert.
People, I've been collecting emails and so forth, and people keep asking me like, how much longer do you have to graduate? They're like waiting, so it's not a problem. But well, it is a little. I need more people. Yep. But I was like more curious. I'm like really curious about the marketing and the digital stuff. Like when you were doing your digital Facebook ads, were you directing them back to your website in particular, or you were just directing them to your webinar? And I love the fact that you were doing upselling. That's awesome. I love that.
Yeah, we were directing them to, when we were doing the live events, we did two things. We were directing that, sometimes we were directing them to a live event, like to a specific live event with a day and a date and a time, right? And that's what they were registering for by clicking on the Facebook ad. And then other times what we were promoting was a webinar, which was a free webinar. That the webinar was really a similar online version of what the live event was. So it was an educational thing and it was free. But we were directing them to the online version, to the webinar. So we did both of those things. And then whether it was a live event or whether it was a webinar event, both of those events at the end of the education, it offered them an opportunity to take another step toward becoming a patient, which in this case wasn't yet becoming a patient. It was actually coming in for a consultation. Mm-hmm. And the way we generally did it is it wasn't a free consultation because we wanted higher quality leads. It was a low cost sort of one-on-one consultation where they basically paid a small sum money. It wasn't going to make us any money, but it was enough to get people who were serious and not other people. And then they were going to fill out paperwork giving us not all but some of their health information so that we could do an actual consult with them to let them know whether we thought we could help them and what that would look like, what the plan would be in approaching them. And then if they're still interested at that point, at the end of that consultation, now you actually make your offer to come and be a patient. Because here's the plan I'm proposing to you. Here's how we go about helping your rheumatoid arthritis or your digestive problems or whatever the case may be. And, you know, and now here's the offer to actually become a patient. And that's where you actually then discuss what's it look like to become a patient? What is the investment involved on their end in that? What are the expectations on yours? And then those people would actually become patients.
Okay, excellent. Yeah.
Does that make sense?
No, that's excellent. I love that. Thank you.
The thing I can tell you is that the more you qualify your prospective patients in some sense, and the more that you ask them to jump through some sort of increasingly bigger hoops to become your patient, the better quality of patient you end up with, right? Because when we first started, we just would take anyone who would come in and see us. Anyone we could get to come see us, we'd have them come and see us. And we did it all on a fee-for-service basis, right? So a fee-for-service basis is like how the insurance system works, right? They come in for a visit, they pay for that visit. The next time you need them to come in, they have to re-choose to come in for the next visit. And then if they do, they pay you for that visit, right? You know, what we do now is more of a subscription type of model. So now what people do is they actually are investing in either a 6-month or a 12-month program in the office where they become a practice member, and they get a certain set of sort of, you know, in some sense, services from us as part of their program. But if you think of it this way, more than anything, you're not really selling them a set of services. You're selling them a solution, right? Mm-hmm. The services are just the means to the solution. If you start trying to sell services, you're not going to be as successful, and you're going to get a different caliber of patient. If you're actually selling a solution, you get committed people who want that solution, and now they're not so stuck on, but what are the services? They're stuck on the outcome, meaning, am I getting better? And then if people are getting better, they're happy, and they don't really care as much what it took to get them better. They're happy because that's what they came in for, and that's what they're looking for. And so what happened back in the old way we did things is we were good at bringing in patients, and we were still pretty good at getting people better, but we had a lot more turnover of patients. You know, we had a huge percentage of patients that came in for a few visits and then kind of like fell off the wagon, and maybe 9 months later they'd show back up because they had been doing better, and now they were doing bad again, so they were back. And what it became is too much of it was crisis management. It was just because people only wanted to spend the money when they really felt like they needed to spend the money because, you know, now it was important to them, but all these other things were more important to spend their money on rather than their health when they were feeling well enough. And for us, we decided that was a non-satisfactory way to practice naturopathic medicine because we were so committed to the outcome. Like, we were so into helping them get better. That was very disappointing for us when people weren't as committed as we were at getting better. So, you know, now what we do is the barrier to entry is higher. They have to jump through more hoops before we will allow them to be our patient. Mm-hmm. And what we're asking them to step up to is a bigger ask, meaning like to buy a 12-month, you know, membership in our practice to be my patient is a much bigger investment than coming in to see me for a single visit with no commitment beyond the visit. But essentially, we're asking them for a bigger commitment, but we're able to give them a full commitment because they're more committed. And now what happens is we have a smaller percentage of leads that become patients, but we don't need as many patients because we have more committed long-term patients that are patients for a year at a time with us. And so we do more work up front to get them, but much less work after that, keeping them going. And then what we have found, the good side effect of that is they're much better patients. Yeah. The compliance level is the highest it's ever been in our practice. It's the exception to the rule now when patients don't do what I ask them to do, right? It's not 100%, but it's more the exception to the rule. And more than anything, if they're having trouble, if they're not complying completely, it's usually because there's some challenge or obstacle we hadn't yet identified to them being successful that we now just have to identify and tackle. It's not a lack of commitment on their part because they've already shown the commitment. And so what it's resulted in is the outcomes are better, the results are better. It's a much higher percentage of patients that get the outcomes they came for because now we have equal willing partners in the process, not hesitant partners, right? And in some sense, that's what you're trading off when the barrier to entry is low. You're going to get more people who jump the small hoop to get in, but you're going to have much greater variability in the quality of those people. Whereas the more you raise the bar, well, the harder you have to work up front, but the much better quality of patient or client that you get.
Yeah, it sounds like what the SCNM Medical Center is doing, that like they're trying to push a motto of, come to us for your routine care, not just in those crisis management situations. Yeah.
Yep.
It looks like
But your model has to back that up. That's the thing. You can say that until the cows come home, and no one will believe you until you back that up. And so, being a parent, I take that a lot like being a parent. Like, your kids will run over you roughshod as long as they don't believe that you're going to back up what you say is going to happen if they don't. But as soon as they come to know that when you say, here's the boundary, and if you cross it, this is the consequence, and that consequence happens, it doesn't take them too long to figure out that it's just a better strategy to do what needs to be done. And I think the same is true with patients. Like, you can tell them all day long, come in for all of your regular care, but if they're still hemming and hawing over what it costs to come in for those regular visits, right, they're going to keep waiting until it's bad enough that now they're willing to spend that money to come see you. Only a small percentage of them are going to be proactive and keep spending that money because they want to stay well or they want to get ahead of it, right? It's just human nature. But, you think about someone who comes in to see me, if they've already paid me for the year, right, and it's a substantial sum of money, you think they're going to show up for the visit when I tell them to, whether they're feeling great or not feeling so good? I can tell you, like, very much so. Do you think that they're going to contact me when they're not doing well? Because that's what I tell my patients. Like, if they're doing well, I say, look, if between now and our next visit, that visit's arbitrary. We're just doing our best to pick the next time we should see you. But 2 weeks from now, you start going downhill, you've been doing well, I expect you to reach out and let me know that so we can get that handled now and not wait for you to be really bad, several weeks down the road. Do you think they do that?
yeah.
Yeah, they do. Yeah, they take it seriously because they have made the choice to invest in their health at that level. And that's what I mean by they're better patients. I mean, we had really good people coming to see us before, but we didn't have really good patients all the time coming to see us, because, oftentimes, unless they were really horribly feeling terrible, getting those new rims on the car or, buying something for the house was more important than taking care of their health, right?
Yeah.
Thank you, Dr. Udell.
You're welcome.
Dr. Udell, I have a question for you,
Yes,
if we still have some time.
we do. We have about 10 minutes, and then I'm doing this again for the naturopathic philosophy class.
Oh, great.
Yes, so I'm getting my Zoom all in one day.
Yeah, I'm actually associated with that group, but anyways, I was wondering kind of what kind of things you say to your patients to kind of demystify them on the whole insurance model when you're doing the cash pay system.
Right. Well, I mean, it's something along the lines of, what we point out to them is we talk about health statistics in the United States. We're treating mostly chronic patients, and we make that connection to the insurance model, essentially. We let them know that,
Yep.
I mean, there's lots of ways you can go about it, but it's something along the lines of the fact that, the insurance system is that we talk about what you get for your insurance, right? In other words, when you have a health insurance card, that doesn't buy you health, right? What it buys you is access to medical care, right? But if the medical care that it buys you access to is essentially sick care, right? If it's buying you access to a system that just manages chronic diseases, but does not help people reverse or prevent chronic diseases, then that's what you get with your insurance card. Your insurance card will get you exactly that. It will get you you know, management of the chronic disease that you're allowed to develop because there's no real preventive medicine going on. And once you have that disease, there's only drug and surgical management of it. There's not actually reversal of the chronic disease. So if you're content with, right, simply managing your chronic disease, then the insurance model is great for you and should probably stick in it, right? But if you're really looking to either prevent chronic disease because you're healthy now, or you want to actually reverse it. You know, you don't want to just take drugs for your diabetes. You want to reverse your diabetes. You don't want to wait till you need a bypass or a stent. You want to reverse your coronary artery disease, right? That kind of thing. Well, then you can't buy that with your insurance system, with your insurance card. It doesn't matter how big your premium is. It doesn't matter how low your copay is. It doesn't matter how many tests or medications your insurance will buy for you. It cannot, in the current system, it will not buy you reversal of your diabetes, reversal of your coronary artery disease, reversal of your, you know, autoimmune disease, because it simply can't. It doesn't offer that. And so if that's what you're interested in, unfortunately, right, because of the way our healthcare system is structured, your only option is to step outside of the conventional care system and outside of the insurance system and actually invest in your health. And that's what our message to people is. If you want to be healthy, you have to invest in your health, because the healthcare system is not investing in you, and it's not going to make you healthy. The only one who's going to make you healthy is you. And even then, the messaging around us isn't, I'm not going to make you healthy. You're going to make you healthy. I'm just going to guide you along that path. I'm going to help facilitate that process. But in the end, when you succeed, it's going to be because of you and your efforts that you have regained your health. And I was just here all the time as just a guide along the way, right? Does that make sense?
Yeah, that's great. Thank you. I appreciate the example.
Yep. And you know what I would say to you guys, again, it gets back to you believe in what you do. It's 100% true, right? You don't have to, like, I don't ever feel bad when I talk about the insurance system or the healthcare system, you know, even if I'm dogging it, because it's true. It's a dysfunctional system, right? And insurance buys you doctor's visits, diagnostic tests, drugs, and surgery, period, right? Sometimes I'll have someone say to me, well, you know, Dr. Udell, you're wrong. My insurance actually will pay for my gym membership. And I said, well, that's great. You have really progressive insurance. That's so great that they'll pay for your gym membership, right? But they don't get you to the gym, and they don't teach you what exercises you should be doing at the gym, right? So they still are just buying you the pass, right? They're not getting you to your end result. And all of us need guidance and coaching, even if we're the patient, on that. And so, you know, you're giving them an alternative that's actually a real alternative. And it's 100% the truth. There's no way to get what we do inside of the insurance-based model. So in some sense, people who are stuck on the insurance thing, even after you educate them, they're not your prospective patients. Your prospective patients are either the people who already realize that the answer is not the insurance system, or who are open enough to where they can be educated as to that reality. And once they are, now they're like, oh, that makes perfect sense. Okay, where do we go from here? Any other questions? I have, like, you know, maybe 5 more minutes if anyone has specifics.
What is something that you wish you would have done differently when you first started your practice as far as maintaining a patient base?
A couple things. One, I wish we would have been privy to something like the model we use now then, meaning like it took us a lot of years of, you know, struggling in this kind of fee for service model to get to what we do now. So I wish something along the lines of, you know, there's lots of ways to do it, but there's these subscription-based models, there's concierge style models, which are similar. There's program or package style models. Like you might do therapies, I don't know, like maybe IV therapies, or you're into acupuncture. So you might not necessarily need to be selling people, you know, a subscription or a membership to your practice for a year, but you could be selling them, you know, 10 treatments as a package, as opposed to one treatment at a time, because you realize that I'm never going to get anyone better with one acupuncture treatment or one IV, right? But you know, I feel pretty confident that most people, you know, 10 IVs is going to get them somewhere that's real, that they're going to feel good about. So I'm not going to bother selling a single IV, and then every single time they come in, I have to resell them the next IV. I'm just going to one time sell them a package of 10 IVs, right? So it's a much better business model for you. And it's actually a much better situation for the patient, because now they're buying more a potential solution and not just a single service that you know full and well is never going to effectively help their health, because it's only one thing. I wish we would have known that in the beginning and would have done that. And then the other thing I wish we would have done in the beginning is the way that we keep in better contact, keep our patients kind of warm and in connection with us, that we were doing more of that in the beginning. So now we do it through a combination of Facebook and Instagram. And besides our public pages, we have a closed Facebook group just for our patients. So we can put different content there, and we can have a different level of interaction with them there. We have a newsletter that we did not have back in the day. We do some email blasts where we also keep them abreast of things going on and things that we're doing. We use now some text services, that text messaging stuff that you know, we didn't have the capability to do previously. They're all ways that even when you're not seeing your patient at a visit today, they still know you're there and they still feel you. And when people feel you like that, well, it's a relationship. They become connected to you, and more of them don't want to leave you than do. And that's what happens in our practice. Even though in the beginning, when we first meet people, we're only essentially selling them one program, be it a 6-month or a 12-month program, but a significant percentage of our patients, when let's say their year ends, they want to know, well, how do I do this again next year? What do we do now? Like, I don't want to leave. I want to stay. And that's all relationship building. And you do that in all these different ways. You do that every time you talk to them. And when you realize that I'm not just doing a visit, I'm not just getting my job done, I'm just not checking the boxes, I'm constantly building the relationship each and every time I interact with that patient, whether I'm talking to them face to face, whether I'm talking to them on, you know, FaceTime or Skype, whether I'm texting with them, whether I'm emailing them. And yes, there's a whole nother can of worms we could open up about whether you want to do texting and emailing with your patients. But for us, the choice is that we open all forms of communication, because to us, it's a relationship business and it's a communication business. And we need to communicate with people the way they're willing to communicate with us. And so we're open to all forms of communication because we want them communicating with us. And every time you touch them, you're nurturing that relationship. And when people feel connected to you, they don't want to leave you, just like you don't want to leave people you feel connected to. And so it's a much more sustainable model. And I don't think we're always good with people, but I don't think we understood all the fine details of that. And if I were to start all over again from the get-go, I would have thought through a lot more of those touch points. How do I continue to nurture the relationship with my patients and let them know I'm still here for them, even when I'm not directly talking to them? That's what I would say.